Hi, my name is Jared Moss. I'm one of the urologists here at Regional Urology. This afternoon we're going to be talking about Peyronie's disease. You may or may not be familiar with Peyronie's disease, but it is a condition that is very common. The most recent studies suggest that up to 13% of men have Peyronie's disease. Peyronie's disease is curvature of the penis during an erection. This creates significant issues for men, psychologically as well as physically. Many times it can be tough for them to be able to have satisfactory intercourse, and creates lots of issues. We know that Peyronie's disease is very common, given that up to 13% of men have Peyronie's disease in some form or fashion. I like to use the illustration with my guys that if there's 100,000 men in Tiger Stadium, 13,000 men in that stadium have Peyronie's disease in some form or fashion. And not everyone in that stadium is going to have significant curvature. There may be varying degrees, but men can report anywhere from mild curvature, maybe 20 degrees off of center, upwards of greater than 90 degrees. So some of the men that have severe curvature, this obviously is going to create a major obstacle from a sexual dysfunction standpoint, and the men with more severe Peyronie's disease are obviously going to be more likely to seek out a physician and seek treatment as opposed to those that have milder curvature. Probably the biggest question that men have when they come in is what causes this? Is it anything dangerous? I've had men that come in and they think it's a blood clot in the penis. They feel like it's potentially a cancer. Most of the time they can feel an area in their penis that feels like a knot or very hard scar tissue, and then they notice the curvature that develops over time as they see an erection. The ultimate answer is we don't know always what causes Peyronie's disease. There are several different theories out there that result from microvascular trauma over time, maybe just very small amounts of trauma during intercourse, but occasionally men will come in and say, I know exactly when this happened. I was having sex, I had an injury during sex, I heard a pop in my penis, and then as my penis healed, I developed this hard area of scar tissue, and I've had curvature ever since. While that is a textbook scenario, it's honestly not very common for the men that I see clinically. Most men will come in and say, you know, it just kind of popped up all of a sudden, I didn't really notice it. My wife made a comment, or I looked down when I had an erection and all of a sudden I had curvature of the penis, or I feel an area in my penis that feels funny and I'm concerned that there's something dangerous going on there. And oh, by the way, now when I get an erection, I have curvature upwards, curvature downwards. It can be to the left or to the right. Most importantly, men want to know what are the treatment options, and does Peyronie's disease have to be treated? The short answer is Peyronie's disease doesn't have to be treated. There's lots of men that will observe Peyronie's disease. These may be men with mild curvature, and as long as they know that it's not a cancer or blood clot or something dangerous, they're very content observing it. It doesn't bother them, it doesn't bother their significant other or wife, and they're able to have sex. For other men that the curvature is so severe they're not able to have sex, these are the group of men that are going to be more interested in pursuing the different treatment options. One of the most important things to establish right off the bat as far as which type of treatment arm you fall into is, does the man have good erections? Can he get a good erection either with no medication, or does he sustain a good erection with a Viagra or Cialis or things along those lines? Because that will greatly influence the way that he is treated. We'll start by talking about the larger percentage of men that present with Peyronie's disease, and those are typically men that present with satisfactory erections with the use of a phosphodiesterase inhibitor such as Viagra, Cialis, or things along those lines. One of the things that we offer is injection therapy. XIAFLEX is the only FDA-approved therapy for men with Peyronie's disease. It involves injections into the penis. It has one potentially dangerous side effect that results in a penile fracture. This is reported less than 1% of the time. I've never seen it in any of my patients, but I know physicians that have been treating men with XIAFLEX and have had this happen. Some of the restrictions when you are being treated with XIAFLEX is I typically will ask my men not to have sex for 3 weeks once they've started an injection cycle of XIAFLEX. It typically involves 2 injections in a week. A lot of times I'll see my men on Monday for an injection. I'll then see them again on Wednesday for an injection, and then we'll regroup around 6 weeks later to see are they having satisfactory improvement in the curvature of their erection. If not, then we may need to pursue another cycle. Men with this type of therapy can get up to 4 treatment cycles. It does need to be approved by your insurance. It can take anywhere from 4 to 6 weeks in order to find out if this medicine is approved. Thankfully, most of the time we can get it approved because it's the only FDA-approved therapy at this point in time, but it can take some time to get there. Another injection therapy that I offer is VERAPAMIL injections. VERAPAMIL is a blood pressure medicine. It is not FDA approved for the treatment of Peyronie's disease, but we've been using this for quite some time. Studies on the efficacy of VERAPAMIL are pretty limited. There are some studies that show that maybe there's some benefit there. There are other studies that basically say, hey, it really doesn't have any benefit at all. But I have guys that swear that they are getting improvement with VERAPAMIL injections. I have other men that say, hey, look, I've given it a shot and I'm really not seeing improvement there. So I talk to my men about that and explain to them, look, this is what you can realistically expect. Here's the risk and benefits. If this is something that you want to pursue, then I'm happy to do it. It typically involves an injection every 2 weeks, and a total series is 12 injections. So it's roughly around 6 months of therapy. There's a numbing medicine that's injected into the penis. The penis is numbed up, and then the VERAPAMIL is administered into the scar tissue area that's causing the curvature. It's important to remember for any man that's pursuing injection therapy, our goal is curvature improvement. It's not making the penis perfectly straight again. In my practice, I've very rarely ever seen someone on injection therapy go from severe curvature to having a perfectly straight penis again. And if that's the patient's expectations and the doctor has different expectations, then both are going to be unhappy. So I talk to men and say, hey, if you've got a 60 degrees of curvature to the left, if we can get you back to 30 degrees of curvature where you're able to have satisfactory sex with your wife or significant other, then that's a win. The goal of injection therapy is basically trying to avoid surgical therapy. There are several different types of surgical therapy that are involved for the men with Peyronie's disease that have good erectile function. One involves incision of the plaque, plus or minus grafting. This is not something that I offer. There are other physicians out there that will offer this. I typically don't offer it because of the side effect profile. You can still have a recurrence of the curvature. You can potentially end up with erectile dysfunction that can be quite severe. Or if the nerves are injured, you can have a penis that has significant issues with numbness, which would further exacerbate the sexual dysfunction issues. The surgical treatment option that I do offer is called a penile plication, and it's the use of a permanent stitch on the healthy side of the penis. And so I explain to patients if they have curvature to the left, then we will place a permanent stitch or stitches into the healthy side of the penis to bring the curvature from the left back to the right. It is important to note that men with Peyronie's disease do report significant shortening of the penis as it's not able to elongate properly with scar tissue. So we are basically recorrecting the curvature with the healthy side of the penis, but men can lose up to 1 centimeter sometimes with this type of surgery as we're having to correct the healthy side of the penis to compensate for the diseased side. Another surgical option that's a great option for men with Peyronie's disease is an inflatable penile prosthesis. This is typically used in men that have severe erectile dysfunction and they have Peyronie's disease. So most of the time they have failed phosphodiesterase inhibitors, Viagra, Cialis. They're not able to sustain a good erection with that. If they use a penile injection, maybe they're able to have some sort of erectile function, but it's still not great and they're having severe curvature. This is kind of your ideal candidate for a penile prosthesis. So to recap, we talked about what Peyronie's disease is. It's basically scar tissue that develops in the penis. The exact cause is not always known. Sometimes it results from trauma to the penis. It's typically not dangerous. Sometimes the Peyronie's disease will get better on its own. Most of the time it will stabilize and it can potentially worsen. We talked about treatment options, injection therapy. XIAFLEX is the only FDA-approved therapy. We talked about VERAPAMIL injections, which are not FDA-approved but are another alternative therapy. We talked about surgical options, the penile plication, as well as an inflatable penile prosthesis for those men that have concomitant erectile dysfunction. I hope this video has been helpful. If you have further questions, please don't hesitate to give us a call, 318-683-0411. Our website is regionalurology.com. Thank you.